Hi, my name is Joelle Griffin, and this is my public service announcement on genital herpes. The genital herpes virus is one of the most common sexually transmitted diseases in the United States. The virus enters through mucous membranes during physical contact. It enters through the skin and it travels through the nerve paths, where it may lay dormant and remain there indefinitely. As the virus becomes active, it surfaces and causes an outbreak of symptoms. The virus is categorized into two types. The first is herpes simplex virus type 1. This is the most common of the two. It's estimated that about 67% of our global population has herpes simplex virus type 1. It is transmitted orally. It can cause genital herpes, but more commonly it will cause cold sores. And so this is a picture of what herpes simplex virus type 1 might look like. Herpes simplex virus type 2 is the more severe of the two types of herpes. It is transmitted sexually and causes genital herpes. It's estimated that 11% of our global population has herpes simplex virus type 2. Symptoms of the herpes virus can include an itching, tingling, burning sensation, followed by painful blisters and ulcers at the site of the infection. There may also be swollen lymph nodes in the groin, flu-like symptoms such as joint pain, fever, and headache, painful urination. The symptoms tend to be more severe for females than for males, and in general, the first outbreak of herpes is always the most severe. Due to the latent stage of the virus where there's no evidence of the infection, most people who have herpes are unaware. In fact, about 85% of Americans are unaware that they have been infected with the herpes virus. And this is a picture of what herpes simplex virus type 2 would look like. As far as prevention goes, condoms are the most effective way to prevent contracting the herpes virus other than completely abstaining from sexual contact. If you do find yourself engaging in a sexual situation with a partner who's been infected, or if you yourself are infected with the herpes virus, it's very important to practice safe sex methods and be very open in your communication. You should also avoid any sexual contact anytime that you're currently having an outbreak. There is no cure for genital herpes. It can just be controlled through medications. They have about 3 different types of oral medications that are taken for the herpes virus, and the dose and the length of those treatments depend on whether it's the first outbreak or if it's a reoccurrence. There are 2 types of therapy treatments. Episodic therapy is the treatment that's taken at each episode of an outbreak, but it doesn't reduce the frequency of the outbreaks, it just helps to maintain it at that moment. Suppressive therapy is the daily medication taken that decreases the frequency and the duration of the reoccurrences, and also can reduce the risk of transmitting the virus to a sexual partner. And this is some pictures of what these prevention methods might look like. That my public service announcement was informative for you and that you learned something new. Always remember to practice safe sex and to get tested regularly if you're sexually active. Thank you for watching, and this is a list of references from my research.